It's not. All right. Full today. And six.
Here today, and I'm grateful for their partnership. Frank, at all. Which these what's going to people who needed it. for this very scarce vaccine, but that's what we had to give out. And every single person vaccinated gets us one step closer to ending this pandemic and getting our lives back. Second, once people were checked in, our operation went smoothly. Especially on our first 2 days, we had an efficient process for most of the people that we served. We had a good drive-thru setup, and we actually had officials from elsewhere in the state who toured our site because they saw the city of Dallas as a model for their own efforts. Third, we were able to weed out many people who made unauthorized appointments. Once we saw that we had a problem with people sharing their appointment links with people who were not invited directly by the city, our city staff audited the entire schedule to eliminate unauthorized appointments. Now, as you might imagine, that is a very, very serious and daunting undertaking. It's a lot of work, but they did it. Now let's talk about what went wrong. While we made a massive effort, we were not able to weed out enough people who made unauthorized appointments. We had thousands of them, and we still had many people who ignored the cancellation or who sadly didn't see their cancellation by the time they were already in line. The bottom line, we simply need a better scheduling system than we have. The one that we have is just not going to cut it for the long term. We are currently working on a solution to this that will stop people from being able to share the link, but this will take a couple of days at least. We also had some people who didn't make an appointment who believed they could simply get in line and try to get a vaccine. Now, we did expect some of that, and we've been clear, very clear, that this site at Cape Bailey Hutchinson is an invitation-only site, but some people tried anyway. This added significantly to Saturday's bottleneck and caused other people who did have a valid appointment to have to wait longer. And finally, we were perhaps a bit too ambitious on Saturday as we tried to get more than 2,700 people vaccinated in a single day, considering the scheduling problems that we were having. While we extended the hours on Saturday to allow for 12 full hours, 12 straight hours of vaccination, the sheer volume of people who made appointments combined with the people who were in line who didn't have appointments or whose appointments had been canceled were a huge contributor to the long wait times. We did get all of our vaccines out, which was the goal, but we obviously put ourselves in an undesirable position in doing so. With all of that said, to all of those who waited in line for hours on end, I want to say that I'm sorry. We are sorry. It gives us no pleasure whatsoever to turn people away as we work to distribute a life-saving vaccine to our people. I know that this was emotionally taxing for the people who sat in line for all those hours, as well as for our firefighters. We need to fix these issues the best we can, and we are and we will continue to be accountable for our results. I'm very excited about the new partnership with Methodist, which we announced yesterday. That partnership should help us alleviate some of the issues we experienced Saturday and will also help us to get this vaccine out to our vulnerable populations faster in the future. But I also would be remiss if I did make a plea to the great people of this city and everyone out there who's listening, if you weren't invited to make an appointment by the city of Dallas, and you will know if you were invited by the city of Dallas, then I'm asking you to please not come. Please don't come if you were not invited by the city of Dallas. We need everyone to wait their turn. If you get in line for this vaccine, and you shouldn't be in line, what you are doing inadvertently is causing delays for everyone else who is supposed to be in line. So I want everyone out there, and I say this with love, to think about your neighbors. Think about others and their loved ones, because we're all in this together. And don't get me wrong, I know this is tough. We have a massive demand for vaccines right now. Senator West and I were talking about that earlier. The demand is just enormous. But we simply don't have enough supply to go around. And as much as it pains me to have to tell people that they have to wait, that's the truth. We simply have to wait. I understand your frustrations. I share those frustrations. I wish we could vaccinate every single person in this city and beyond tomorrow. I wish we could even, my Methodist friends in the medical profession, I had the idea, I wish we could send the vaccine to every person in the mail at their house or their apartment, and everyone could just give themselves the shot, and we could all be done with this. I wish that were the case. But the reality is right now, with the current system that is in place, we must have a process. We are required to have a process that prioritizes people based on the recommendations of public health experts, not politicians like me, not members of the Dallas City Council, nobody. Public health experts are going to determine the prioritization of the distribution of this very limited vaccine. It's not a perfect process. It's not a process that cities without a health department like Dallas typically even have to manage. But we're working on it. We're doing the best we can, and we're going to continue to work hard to improve this process. We're committed to making improvements as we go. Ultimately, if you think about it, with respect to vaccines, we're really back to where we were in the early days of this pandemic with respect to testing, if you all recall, when we were working through the kinks of that system. Nowadays, less than a year later, you can get a test very easily and at numerous sites. And it's my hope that soon we'll be at that same point with respect to vaccines. But until then, we're working with the resources that we have, and we will continue to refine and adapt our strategies as needed to ensure the best possible experience for those who are currently eligible to be vaccinated. I want to thank all of you for being here, and with that, I'm going to turn it over to Rocky Vaz, my newly reappointed Emergency Management Coordinator. Thanks, Rocky.
Thank you, Mayor. So, Mayor laid out what happened over the week. I'm not going to repeat that. I'm going to talk about what's going to happen this coming week. We have been allocated 4,875 doses of the Pfizer vaccine. And as the mayor mentioned, we have been working with Methodist for a week or so now, and we all got on a call yesterday afternoon to iron out all the details, and them agreeing to be a partner. And I want to thank Methodist for that, and we'll talk about what that looks like. So we are going to start our vaccination at the convention center on Wednesday and Thursday, 2 days. We'll do 1,000 doses per day. Methodist, as our new partner, will be doing 3,000 doses, 1,500 on Thursday, 1,500 on Friday. And they will talk about their process on how they will schedule people. We are still going to be using the same database from Dallas County. We will have a certain number of names from that database that will schedule the 2,000 appointments, 1,000 a day. Methodist is also going to get a list from Dallas County, prioritized based on public health experts on who should be getting the vaccines, and they will schedule their own system. So with that, I'm sure there are going to be questions. I'll take some questions later on, but I will have Methodist, Senator West, and then we'll go down. Thank you.
Mayor Rocky, thank you very much. It's a pleasure being here today. I'm headed to Austin right after this to deal with redistricting, but that's a different subject. I would urge our congressional delegation to work with the president to pass the $1.9 trillion request, which includes monies for vaccines, vaccine distribution within that particular bill. We right now are witnessing in our lifetime something of biblical proportion. We've read about it, we know about the Spanish flu, and now in 2021, we're experiencing a pandemic, something that many public servants have never prepared for, but we're doing the best that we can do. From the state, from the federal government to the state, county government to local governments. We've got to make certain we continue to have cooperation. We've got to make certain that we ask the public to be patient. Yes, there will be mistakes, but you should judge the persons implementing this system by whether or not they recognize the mistakes and then take action in order to solve those mistakes. The mayor has laid out exactly the entire system and some of the things that happen. And needless to say, the city of Dallas is taking steps in order to correct them, bringing on new partners, as we should. What I would like to see is a continued ramping up of distribution here in the state of Texas. I think we were at about 300,000 last week, and we're at about 500,000 this week in the state of Texas. And the recognition that that's for the entire state of Texas. FEMA has said that they would be reimbursing cost related to COVID. I'd like to see more outreach in hard-to-reach communities that right now steer fear the impact of these viruses in terms of adverse reactions. We need to make certain we're going into those communities, getting them registered, and making certain that they are able to show up. We need to make certain that we are dealing with the homebound. We need to make sure there is a mobile program where we can go into those communities, the homeless community, the minority communities where that it's hardest hit, that are homebound, no transportation. There needs to be some more creative thinking about how we get people registered and get them vaccinated, with the recognition that those monies will be reimbursed by FEMA, making certain that the costs that obviously that are being incurred are in fact reimbursable costs. But what I say to my friends, my neighbors, my constituents here in Dallas, be patient, sign up, take your turn, and make certain that you get that vaccine and get vaccinated, because it is what needs to be done in order to turn the pandemic around. Thank you.
Good morning, everyone. This is State Representative Angie Chen Button. My district covers the northeastern part of Dallas County. I do have a small part of Dallas City, but I am here to support this great effort because I For example, Washington Convention Center, and also in my own hometown, the Homer B. Johnson Stadium, they all become hubs of the vaccination center. So there are a lot of progress made. And I'm so popular now, oh, I just don't talk loud enough. Okay, so let me talk louder. There are a lot of improvements have done, including the distribution, the computer systems, and then unfortunately, people don't give it enough credit. I can understand the frustration when you saw you're gonna get the shot, but you didn't get it, and you're looking over the places, try to find the place, then you can go, especially for the families have senior citizens. But listen, a lot of wonderful people, including the firemen here, and earlier Mr. Fireman was joking with me, says they are firemen, they were now trained to handle the computer systems. But you all took the challenge to make a difference. In my own hometown, and listen, I live in a very, very nice place. But in Garland, do you realize the zip code 75040, just next to my own 75044, that when you look at the chart for the coronavirus infection, they are as dark as some of the South Garland zip codes. So this is not a situation with the Dallas city or certain area. This is a situation, this is a crisis for every place. Then you see, so let's all work together, and I want to thank my own senator, Senator Nathan Johnson, and also my colleague here, Representative Vanessa Bay. She also is a part of the Garland. The Garland leadership, the Garland mayor, Skylar May, the team, everybody worked together. And I'm just giving some examples. There are more people out there really want to make a difference to improve the situation. Of course, hopefully we will get more help from the federal. And you all know tonight, our Governor Greg Abbott, his State of the State speech, he is going to address this situation as well. But let's keep on raising our voice and telling everyone we need more vaccines. We need to continue to improve the distribution process so ordinary citizens, they can come and get their shots to protect that. I think that's the number one issue on everybody's mind. Can we live a normal life without the vaccine implementation? I don't think we'll be able to do that. So please, like the senator say, be patient, be positive, allow way to make an improvement. But once again, only allow us to make an improvement is not good enough. Upstairs, the federal, the state, everybody needs to come in to help us out. Thank you for having us here. Once again, more vaccines, better distribution systems. Thank you.
Do we need to pause? Is everyone good now? All right. I guess the theme of today is adaptability, right? And all right. Well, with that, I'll turn it over to Representative Niave.
Good luck.
Thank you. Good morning. My name is Victoria Niave, and I serve as state representative for House District 107. I represent parts of East Dallas, Garland, and Mesquite, Texas. I also serve as a Democratic co-chair for our Dallas area legislative delegation. I want to thank my colleagues, Chairwoman Button, Senator Royce West, and our former colleague, who we miss, Eric Johnson, the Dallas mayor, for inviting us today to come witness and tour the center where our fellow Dallas residents are obtaining the vaccine. We know that it takes so many hands on deck, so we want to commend the city of Dallas. We also want to commend the Dallas Fire Department, the chief, for talking to us about and showing us what the system that's in place for our city. And as I walked around here in the site that we're at, it reminded me about what our city did back when we had hurricane residents come who were displaced from their homes. And so we want to thank all of our fire department, all of our first responders, all of our nurses, our hospitals for putting themselves, and city employees as well, for risking their safety to be able to help fight this global pandemic. So not just from the national level, we know that with Joe Biden and Vice President Kamala Harris, from the national level, we know that there's advocacy to bring more vaccines right here to Texas and all across, and to speed that process. I will tell you, at the state level right now, in a legislative session, our delegation, or my colleagues that are here as well, are working hard every single day to bring as many vaccines as we can right here for our fellow residents in the Metroplex. We're going to continue to work because we know that the economic recovery of Texas is inextricably intertwined with the public health of our residents. And I'm going to say that again, because the economic recovery of Texas is inextricably intertwined with the health and the safety of our Texas residents. So in order for us to get this pandemic under control, we have to get as many individuals vaccinated. We know that there is a shortage or disproportionate access or disproportionate number of signups from our understanding to get the vaccine. So we encourage folks to help your neighbor, help other individuals that you know that qualify under the 1A and 1B to get signed up. If there is a neighborhood, we're going to be working also in our district to be able to help residents get signed up to register for the vaccine. So again, I just want to thank the city, thank all of our first responders for everything that they're doing to get individuals vaccinated. And I'm going to say a few things in Spanish as well. Mi nombre es Victoria Niave. Is there Spanish media? I just want to make sure before. Okay, thank you. Mi nombre es Victoria Niave. Soy representante estatal por el Distrito 107. Represento partes de Dallas, Garland y Mesquite, Texas. Y como legisladora latina, vine hoy para mirar el sistema que tiene la ciudad de Dallas para ayudar a nuestra comunidad que se vacunen. Ahorita es bien importante que se registren en los sitios de web que pueden poner aquí para que se registren para la vacuna de COVID. Nuestra comunidad fue desproporcionadamente y demasiadamente afectada por esta pandemic, la coronavirus. So, queremos que ayuden sus primas, a sus abuelos, sus familiares que se registren para esta vacuna, y nosotros como legisladores estamos haciendo todo lo posible para que tengamos más vacunas aquí en Dallas-Fort Worth. So, muchísimas gracias. También quiero reconocer al senador Royce West y la representante Angie Chen Button. Si necesitan algo, también pueden contactarnos a nuestra oficina. So again, while we're facing so many challenges and trying to do what we can in the Texas legislature, trying to make sure that we have a budget that gets our small businesses back on track, takes care of our schools. We know that there's been a digital divide from the COVID pandemic and lots of children not having access to Wi-Fi, for example. We're going to continue. There's been a significant increase in domestic violence right here in the Dallas area, unfortunately, and all across Texas because of the pandemic. As we're working to try to address those issues at the state level so that all individuals are benefited by the new laws that we're hopeful to pass, we want to thank folks for doing everything that they can right here. And again, we thank our mayor in the city of Dallas. So thank you. I'm Victoria Niave.
And we'll finish up, I guess, before we take questions. We have Pam here with Methodist, and I think you were going to say a few things about our partnership that we mentioned earlier.
Good morning, everybody. I'm Pam Stoyanoff. I'm the President and Chief Operating Officer for Methodist Health System. First, I just want to commend the Mayor and Senator. Nice to see you. And Rocky, we've been working all weekend and for some time last week on this partnership. And you know, providing the vaccine is not an easy thing to do. So I want to commend you for stepping forward and having the courage to do this, because this is not easy. You know, as you might know, Methodist Health System was the very first hospital, Methodist Dallas Medical Center in Oak Cliff, first hospital to receive the vaccine in North Texas back in early December. We were one of only 4 hospitals in the state of Texas to receive the vaccine on that wonderful and glorious day. And so we've been providing vaccine now ever since, and we've gotten pretty good at it. You know, I want to say that I'm proud of our city, we are proud of our state, and we are proud of our health system. Just really happy that we're able to work in joint effort with the city of Dallas to provide this vaccine. And you know, Methodist has been around for 100 years almost. Our mission started in the southern sector, and that is where it exists primarily today. We want to help the citizens of this region, but especially the citizens in the southern sector, to receive the vaccine, those who struggle the most in actually having access to health care. And so we're happy to be able to do that along with the county and the city and our own selves. We thank you for allowing us to join you. We're proud to work together, and I'll take any questions. Thank you.
Can I ask, is anyone streaming this? Okay, so I'll repeat your question if that's okay. Yeah. Yeah, so the question is whether their Methodist is using the city's allotment of vaccines and whether they have their own that they're also throwing in there. So, go ahead.
So Methodist will be using the city's allotment for the vaccine. We are not currently designated as a hub ourselves. We're working on it. And Senator West is helping us and others. So we would love to be a hub, especially to serve our community and our patients. But currently, we'll be using the city's vaccine to help them.
Stand up here. The question was, how will Methodist distribute the vaccine? Okay, and I want to also be clear that it's not our entire allotment that Methodist is getting. It's 3,000. So go ahead.
Okay. So we'll be getting a list that the city will provide us, and we'll work from that list. It'll come, we think, in an Excel file fashion, and we'll be able to upload that to our system, and our registration process will take place from there on. So we will be able to electronically notify folks of appointments. We will have an ongoing, a system that will call them, that will physically call them. And if they answer their phone and accept the appointment, then they'll be scheduled. If they don't answer, it'll leave a message, it'll try them again. And after a couple of times, if it can't get through to them, it'll move on to the next person on the list, right? So we will push it out rather than having people come to us to ensure that only those on the list actually receive the appointment.
Damon. The question is whether Methodist will be distributing through its main campus or there'll be other ones.
So there still are a lot of restrictions from the state on transporting the vaccine. And so we will be distributing this on the campus we started at, which is Methodist Dallas Medical Center. That is actually where we have the freezer storage for the Pfizer vaccine. It's also where we have adequate parking and access to receiving the vaccine, and where we're already set up, where we've been delivering all of the doses we've given since early December.
Anyone else? We haven't taken Ken's yet. Ken? Okay, so the question is, Right. I think I'll turn that one over to Rocky, but the question is whether the partnership was to expand our capability of doing this or whether it was in response to the issues that we had on Saturday.
So the answer is both. We knew we had a challenge on Saturday. We know what our capacity here is. We cannot do 2,700 in a day, especially in downtown. We're lucky that happened on a Saturday. We didn't want to have that gridlock on a weekday going forward. And our partnership with Methodist, and again, thanking them for stepping up, is looking into the future. When we know, it might not be next week, but we know the vaccine supply will get better, and we know we'll get more doses. And we want to build partnerships where we can share vaccines and do it effectively, do it in a timely manner, do it with the utmost customer service that we can provide to people. So that's the plan, and we'll be evaluating it week per week. Like Pam said, they're also waiting to be designated as a hub. If they do get that designation, they get their own supply. We'll have to look at the partnership, how they can support us, but that's an ongoing conversation we'll have with them. So the question was, how are we distributing the vaccines between us and Methodist? So we are getting 4,875, let's say 5,000. Methodist stepped up and said they could do 1,500 per day for 2 days on Thursday, Friday. So we're going to transfer 3,000 vaccines to Methodist. The remaining 1,875, we will schedule 2 days, Wednesday and Thursday, to get it done here at the convention center.
All right. I think we actually have another tour to give after this. So Steve, hold that question just because I think that's a clerical fact question that we can get back to you on. Did you have one? Yeah, that's going to be a question for Dallas County. So the question is whether people from the city of Dallas have received doses from the city of Dallas. Yes, they have. We don't know the number right now. We have to get that demographic information. All right. With that, I'll stick around if you have any more of those kind of clerical questions, but they've got to move on to their tour. We have a. Sure. He hasn't had to. Yeah. Okay, the question is basically comparing this to Dallas County, whether we were more sensitive to those issues that happened there.
Thanks. We had a nice system going there, Steve. We're trying to get the question repeated so people can hear what the question was before I start answering. Take off my mask here, too, so you can see me a little more clearly here. So I've always been sensitive to the undertaking of distributing a vaccine that's in short supply when you have massive demand and you need to vaccinate a large number of people in order to achieve herd immunity. That's not new information. That's not new to me. I don't think it's new to anybody. I've always been sensitive to that. But I think there's a reality here that we have to acknowledge and then work from, and that is there's a difference between the city of Dallas and Dallas County. Those are two different entities with two different responsibilities. Dallas County is the health authority of record, is our local health authority for the city of Dallas and the vast majority of all municipalities within Dallas County, with some exceptions. For example, city of Garland has its own health department, but the city of Dallas does not have a health department and hasn't in recent memory. We rely on Dallas County for health services, like most of the municipalities in the county. Now, We have known, everyone who's paying attention has known for almost a year that this day was coming, the day where we would have a vaccine and it would need to be distributed. And health authorities and entities that have as their mission and who receive tax dollars and who have contracts like Dallas County has with us, where we pay them to perform health services, should have been, and I assume have been, doing some level of preparation for this day for nearly a year. That is a very different situation than a city like Dallas that is not a health authority at all, does not operate a health authority at all, who is looking at a situation where its residents are hurting and people in the region are hurting, and is saying, we want to help. We are going to step out beyond what we do in areas that we have not been charged with handling to assist. And so what we've done, these are the facts, Steve, what we've done is we've reached out to the state and said, don't take anyone else's allocation away, give us more. Give us something on top of what Dallas County and others have received. And they granted that request. We actually have more vaccines as a result of the city's intervention in this community than we had before. So we got 5,000 more doses. And then we had to come up with, on very short notice, a way to distribute those vaccines. And so what we are doing, if we just lay it out there, is doing something that is not within our wheelhouse, but needs to be done. We're stepping out into a void that needs to be filled in order to assist the county in their primary responsibility, which is to distribute this vaccine. And since we've touched it now, I'm standing here before you saying we're going to take responsibility for what we don't do well. We're going to be held accountable for that. I'm going to stand here before you and account for shortcomings in our system. But let's not ever lose sight of the reality of the fact that we are doing things that are not our primary responsibility when it comes to public health. That is Dallas County's responsibility. We are trying to help, and I think getting 5,000 vaccines into the community, and I can't say into the city of Dallas because, as you pointed out, Steve, they're going to anybody who was on the county registration who's, we're vaccinating people that the county sends us a list of 10,000 people from their registry to vaccinate. We don't get to say, and we have not said, only send us City of Dallas residents. We're vaccinating anyone the county tells us to vaccinate as quickly as we can. So everyone needs to know that the men and women of DFR and Rocky Vaz and his department over here at the city really should be commended for the effort they put forward, the work they put in, the tireless work, the many hours to doing something that is not what they were trained to do and is not what we receive a single tax dollar to do. I talked to Senator West and the delegation about this earlier. We receive $0 to do what we're doing. We are paying for this service out of our pockets. We don't have CARES Act money for this. We don't have any money that we've been given by the federal or state government at this point for this. We are going into the taxpayers of Dallas's funds to do what we need to do to protect our city, because this virus doesn't care about the city limits of Dallas. And we want our economy back, and we want our lives back. And so we are doing what we have to do. And I want everyone to understand that we are pulling together to get through this as fast as possible, and that's why we stepped up.
Thank you. Thank you.
Express West.